The Great Indian Problems of Indian Society. Challenges faced by the women. The main problem that lies in society is the rules set for women about conduct and behavior. Some of them are problematic, as a woman cannot step out at night without a man. This subconsciously is only promoting the idea that women are unsafe, and due to this, in many homes in India, the families treat the girls differently than boys. 1. Low sex ratio at birth. The sex ratio at birth for the country was still 929 females per males, and an improvement from 919 in 2015-16, but still lower than the natural standard of 952 female births per 1000 male births. 2. Women and health. Women, despite working as caretakers both in and outside the household, are the most neglected lot. Promotive and preventive health of females are equally important and must be stressed upon. Health scenario of women. Malnutrition. As many as 57% of women aged 15 to 49 were anemic in 2019-21 compared to 53% in 2015-16. Maternal malnutrition has been associated with an increased risk of maternal mortality and also childbirth defects. Lack of maternal health. Poor maternal health not only affects a child's health in adverse ways but also decreases a woman's ability to participate in economic activities. Non-communicable diseases. Commonly occurring issues such as PCOS, polycystic ovary syndrome, breast cancer, and endometriosis are still subject to taboo and stereotypes. This reflects the current state of women's health in India in a poor light. The health of adolescent girls. At the adolescent age, 70% of the girls are anemic, and their problems related to their menstrual health and hygiene often go unaddressed. Teenage pregnancies. There are 3 times more chances of deaths of girls in teenage pregnancies. The reproductive and sexual health needs of women are often ignored. Adolescent Friendly Health Services Program. Rashtriya Kishore Swasthya Karyakram is there where female adolescents are sensitized about their health. Violence. Crime against women. Gender-based violence against women is among the most egregious and commonly experienced abuses of women's rights. Intimate partner violence, female genital mutilation, early and forced marriage, sexual and gender-based violence, are a barrier to women's empowerment and gender equality, and a constraint on individual and societal development, with high economic costs. Cybercrime against women. The open and unregulated nature of the internet and the irrelevance of geography means that the internet provides fertile ground for criminal enterprise. Incidences of harassment through emails, cyber stalking, cyber defamation, cyber bullying, cyber grooming are getting more frequent nowadays. National Family Health Survey NFHS-5 points to rising instances of domestic and sexual violence against women in the state. The survey shows that married women between the ages of 18 to 49 who have ever experienced spousal violence has more than doubled from 20.6 in 2014-15 to 44.5%. 4. Gender discrimination. Gender discrimination is the unequal or disadvantageous treatment inflicted on someone because they belong to a specific gender. It is usually the women who usually have to face such gender discrimination. 5. Challenges posed to women education. High dropout rates. Increased female enrollment is compromised by persistently high rates of dropout and poor attendance of girls relative to boys. Social factors. Early marriages. Girl children are not allowed to go outside the house. Health factors. Frequent ill health of the student, especially female, due to lack of nutritious food and unhygienic conditions in living areas. Patriarchy and social perceptions. The position of women in the social, political, and economic system is very low. Son preference. Boys, highlighted in Economic Survey 2018, are educated in private and better schools which are of perceived better quality. Quality of education and infrastructure. The absence of a girl's toilet is a common complaint and can cause parents to decide that it is not worth their girl child going to school.